Okay, Mike, tell us your view on extractions and how that impacts the face and the airway and what you're doing differently.
Well, I think, I don't extract teeth. Sometimes I will ask for some baby teeth to be taken out a little bit early to cause what we refer to as an auto-rotation. But apart from that, which is relatively rare, I would never want to take teeth out. I have a big problem in therapies, this orthotropic therapy we provide, with a lack of, too much space, a lack of teeth to fill the gaps. So I would never want to take teeth out. I do sometimes get an older patient who comes in who is very crowded, and I'll say, well, what do you want? And we'll make a compromise situation where I might take some teeth out. But that's where I'm not going for an ideal result. As a general rule, I will want every teeth in the head because I want a full 32 teeth in the mouth. Now, my big worry is if you do take teeth out, and often there's a little bit more space after you've taken the teeth out than you really wanted, and you then close that space down, not only are the mechanics you're using, which is usually fixed appliances and elastics or other things, those mechanics will pull the top jaw down and back, but also, as you close that bit of extra space, you're reducing the tongue space. And as you reduce the tongue space, you're then going to have some compensatory mechanism, which is often moving the head forward, placing the tongue into a different position of the mouth, maybe opening the mouth even further to compensate for that reduction in tongue space. And that it could be quite damaging.
How does that affect the face and the posture and
Well, all of this is taking the face down and back. And as the face goes down and back, and the posture, because you're damaging posture if you're reducing the tongue space, because the tongue then can't fit in to the oral cavity with your lips sealed, so you're damaging that postural position. But it would tend to make the face lengthen.
okay.
It will make the maxilla move down and back, and the mandible will hinge open as it goes.
Okay. Mike, I know you have to run and see patients. Any what is the most important thing you'd like to get across to parents who are watching this?
Choice. You need to make an informed choice. You've got to decide for your child what you think is the best thing for them. Now, what it makes me the most angry is people coming to see me at 12 to 14 years old who have been seen by an orthodontist or even been watched by their dentist for years upon years. They know something is going to be needed to be done, but no one has told them there are early interventive therapies that really work very well. I mean, probably the most evidence-based therapies. So they have missed out on that evidence-based choice because someone has neglected to tell them.
Okay. And what's the biggest change you'd like to see in the way orthodontics is applied and prescribed?
Oh, I would like a sea change. I would like pregnant mothers to be informed of the importance of closed mouth, the importance of moving on to tough food rather than too much sloppy food, the importance of standing up straight and shutting your mouth. This is not a new idea. All it's been is reformulated, repackaged, and presented in a scientific method that works. Stand up straight, shut your mouth. This should be a common mantra. It was a common mantra. Parents have trained their children probably for thousands of years. We need to just follow that common sense. From a very young age, hopefully we can prevent the orthodontic need. Tough chewing, maybe tough chewing gums if necessary, different food choices, a repetitive reminding of patients, just saying, parents saying to their children, keep your mouth closed. The power of suggestion is very powerful under about the age of 2 years old. But parents don't know. They have no information on this. And we talk to so many other things that I think are far less important and miss out on what could be some very, very vital concepts.
And I guess Can you rush out and breathe through your nose?
Yeah, breathe through your nose. I mean, stand up straight and shut your mouth. You're going to have to breathe through your nose.
Yeah.
And you need your tongue on the roof of your mouth. This follows the tropic premise that my father came out with many years ago. And it is evidence-based. It's scientific. It is difficult to change.
Why is that?
Well, it's difficult to give up smoking. It's difficult to lose weight. It's difficult to become fit. It's difficult to learn another language. These are all difficult things because we're creatures of comfort. Humans don't want to step outside of the comfort zone they're in and start doing something completely different. It's tough. Changing posture is a very, very difficult thing to do. When you ask most physiotherapists, they reckon they can get 60% of people to change their posture to a certain degree, not even perfectly. It's not an easy thing to do.
What would you tell parents about the misconception of genetic limitations versus environmental causes to retruded maxillas?
The profession and the lay public seem convinced that facial form is almost entirely genetically determined. Sometimes I feel that this is, it's more comfortable to be fatalistic. Because if you believe it's deterministic, if you believe that you influence how your face grows, then if you have crooked teeth, if your face doesn't look great, then it's your fault. And parents that come to see me sometimes get quite upset by the suggestion that, by inference, it's their fault their child's face hasn't grown to be what it is. Remember, as soon as we start talking about faces rather than teeth, we become very emotive. And it's a very emotive subject because your face is who you are. And any suggestion that it hasn't grown perfectly, it means you aren't perfect. You are correct. And it seems ingrained within the public consciousness, despite the fact that we've been anatomical humans for 220,000 years. None of our ancestors had crooked teeth. None of the other 5,400 species of mammal have crooked teeth, apart from a few domesticated cats and dogs, and feral foxes and some zoo animals. All the indigenous populations alive today have perfectly straight teeth. And all of these groups have straight teeth from when they're born to when they died. There's no secret midnight orthodontist running out onto the savannah, straightening the lions and the tigers and the zebra's teeth. It's ridiculous to even think this. And yet, all of these massively wide range of other living species, in fact, nearly all vertebrates that need straight teeth have straight teeth. It's crazy to suggest that it's anything but a huge environmental influence. By and large, about 200 years ago, the masses, so not the privileged few, but the masses had straight teeth.
And then I guess what changed in the way we live to cause us to have crooked teeth?
Well, we've had a sea change in the way of our masticatory effort. We used to eat incredibly tough, hard food. You'd have populations that lived on a knife edge between starvation and survival. You ate anything you could. If you had to eat the bugs in the tree bark, you ate the bugs and the tree bark. That's what you ate. We would wear our teeth completely away. I mean, a sea change in difference to the effort we make now. It's kind of estimated that in North America now, most children could survive calorifically only on the drinks that they drink. That would be zero masticatory effort. Then at the same time, we're getting blocked noses. Now, allergies is not my subject, but I know this allergy pandemic is occurring within modern society. Now, if you can't breathe through your nose, you have two options. You open your lips, you drop your tongue from the roof of your mouth, and you open your mouth, or you die. You don't have any other options. And this is occurring at the precise moment that you're trying to stand up and learn to walk and program your postural centers. And most kids are standing to walk like this. And it becomes ingrained in them. I can recognize friends of mine by their posture. In fact, I have an osteopath that works locally who treats us multiple personality disorder patient, and you can see what personality she is occupying from the way she postures. Posture is very ingrained. It's part of who we are. Changing it is as hard as changing you. Now, if you have weak muscles and you have a low tongue posture and even an open mouth, your face drops down. You don't have the strength. Your teeth don't come into contact as often, and your tongue's not up on the roof of the mouth, holding the roof of the mouth up. So the indirect forces of biting, the direct force of your tongue on the roof of the mouth, both are decreased. Then your face lengthens. If you only have so much face, if your face is going to be longer, it's going to be narrower and it's going to be shallower. The top jaw has dropped down and the bottom jaw is hinged back with it. And as that occurs, of course, on the cross-sectional level of the teeth, you have your teeth, you have your airway, and you have your tongue. And if that area at this level gets constricted, the other bits, the muscles and the veins and the arteries and the bones, they can't change their dimension. So what happens is you will end up with less space for the teeth, which is why we see malocclusion. You have less space for the airway, and consequently the tongue and the jaw are placed in different positions in compensatory mechanism, so that you can compensate for this insult to your airway. Now the most common compensation is to stick your head forward. If you've ever done CPR, cardiopulmonary resuscitation, the first thing you do is you tip the head back. That makes more space here. Well, you can gain the same effect by holding your head forwards. You hold your head forward, that creates more space. That's the first compensation almost all modern society has done. Now, without the tongue on the roof of the mouth to hold the head up, is also helping that head fall down. And then you will select different patterns of compensation. So the classic pattern is to put your tongue low in your jaw and hold your jaw forward, which is very common in the Japanese, Chinese population, and they develop long, pointy jaws, which we've termed class 3, because it's the habits they will go to. Then you have the typical Caucasian thing to do, which is to hang your mouth open with your tongue forward. And that's the classic Caucasian thing to do. So malocclusion, or this change in the facial shape, which we've termed craniofacial dystrophy, that happens due to the environment. It's quite clear this is due to the environment. All of the hard evidence suggests that. But the particular way an individual goes wrong depends on him. Depends on his genetic predisposition. So if you have someone with the same genes in the same environment, there's a good chance the same thing will go wrong to them. But seeing similarities between individuals and ignoring the environment means you will assume it's a genetic condition. But then we think of the way we live now as normal. We think of the wearing clothes, we think of sitting in a heated environment, and nothing around me, nothing right now was not conceived in the eyes of man. From the roof above me, to the carpet below me, to the windows and the wall, this was all made by man. Everything, and the food I eat, the glasses I'm wearing, how I've got my hair cut, nothing this is what we could call normal. I would have very little to say if I met a hunter-gatherer. If I met a hunter-gatherer now, we'd probably not have, I'm not got a conversation pieces. We've diverged so far that we forget about it. We just assume this is normal. And yet this is clearly not normal. This is clearly causing us problems, which we could minimize greatly with just knowledge, just understanding it. Because when you want to treat something, you have to know what causes it.
Okay.
That's the fundamentals of medicine.
So basically, we have this problem with our modern lifestyle causing smaller jaws and retruded jaws, which hurts the airway, and then you have orthodontic treatment that makes it worse. Is that what's happening?
I think so, yeah. I think you've hit the nail on the dot. I think that you're very right that we have an underlying teeth straight, they're not going to stay straight.
Hmm.
And yet, our teeth always stayed straight. So, we need to see things for what they are, speak the truth, have good evidence, follow the scientific process, and start with the cause of the problem. The etiology of malocclusions. We don't know the cause of the problem, we don't know where we are, and we don't know where we're going to go.
So, Mike, like I've seen tons of studies, at least 30 or 40, starting from the early 50s, 1950s, saying that, headgear causes the jaws to grow down and back. This is a disastrous side effect. It affects respiration. It affects posture. Yet people still do that. Maybe through other appliances that also cause headgear effect. And I've seen, equal number of papers dating back from the early 1900s in peer-reviewed journals that say when you constrict the maxilla, you constrict nasal breathing, and it's a dangerous thing to do. So why do people still do it, despite all the published evidence?
Well, you've got the situation. You've got 2 points here. You've got the first point that orthodontics, it's a science looking for a scientific basis. So it lacks an etiology, epidemiology, pathology, or a cure. Lots on treatment. I mean, almost more treatments than I can imagine, which is a little bit scary, actually, when you look at how many different types of treatments they are. So you've got a real scientific hole. You've got the lack of science, but also it's become a big business. And if all of the things that we're saying were to be applied, orthodontics would not be as lucrative a career. Changing the environment is not as lucrative as fixing something. I mean, who makes money, a dietitian or a liposurgeon? Because one drives a Ferrari, the other cycles a bicycle, and yet who's really helping out? Fixing things is much more lucrative. And once you have people in a position of status in professoralships, you've got whole teaching establishments, and that they don't want to change. I mean, you've got an either-or situation. You've got the genes or the environment. And I'm afraid someone's going to be wrong. And people don't want to be wrong. And people want to continue. I mean, a lot of people have given up headgear. I think that's one step a lot of people have gone. But headgear is something I would never condone. I think that I would completely agree with you that headgear probably should be outlawed. As Birte Melson went on national television in Denmark, I think in the 80s, saying that headgear, it should be banned. But things change slowly, particularly when you don't have a really good scientific base within a profession, when it's not being scientific, it's not being pushed to be scientific, and it's become very commercial.
Mm-hmm.
Cool. I've got to go.
Okay, thanks, Mike.
Take care.